Hi everyone, my name is Nicole Wilps. I'm the coordinator for our Joint and Spine program here at Monmouth Medical Center. On behalf of our entire team, welcome and thank you for choosing Monmouth Medical Center for your upcoming spine surgery. Please note that this class will be very generalized, so we do suggest that you still come to an in-person class during your scheduled pre-admission testing time at Monmouth Medical Center. But if you do have any surgeon-specific questions or any questions in general on the material that we review, please call me or email me about absolutely anything. I do work closely with your surgeons and could answer the majority of questions that you might have before or after your surgery. Again, my phone number is on slide 3 in your packet. Now, another important person that you'll meet while you're here in the hospital is Carol Ball. Carol Ball is our case manager. What that means for you guys is that she's in charge of your discharge planning. So there's two options after you leave the hospital after a spinal fusion. The more popular option is going straight home after your surgery. If you do go straight home, oddly enough, there's not much that you're going to need. Right after surgery, we do not like to do outpatient physical therapy. Although we do physical therapy here in the hospital, that therapy is really just to get you home safely. When you leave the hospital, there is no outpatient physical therapy for the first several weeks, which means you or our case manager do not need to set up any outpatient and in-home therapy right after the surgery. A lot of people ask about setting up a visiting nurse at home. The vast majority of our patients do not need a visiting nurse. The dressings that our surgeons put on now are nice waterproof dressings, so you could shower with them on, and they actually are meant to stay on until you see them in the office after your surgery. So you don't need a nurse coming to your house to change it either. So what does our case management team do for you? If you're going home, they're going to set you up with any equipment that you need. Insurance will cover a rolling walker for you. Most patients will use a basic rolling walker after their surgery for the first several days up to the first several weeks. That rolling walker will be put through your insurance and get it delivered to your room before you're discharged from the hospital. Patients often tend to need a raised commode as well. One of the places that we tend to strain our lower back is a toilet seat. So if you do have a low toilet seat, we would get you a commode. If your insurance covers the commode, again, we will get it delivered to your room before you're discharged from the hospital. If you are not safe to go home, so if you don't have any support at home, or your surgeon feels that you would have a safer recovery at a rehab stay, we will arrange that when you're here in the hospital. Please note that it's not until you're physically here in the hospital that we can get your insurance's approval for that rehab stay, so we'll take care of it when you're here. If you do have any questions on your discharge, whether it's home or to rehab or equipment, please call Carol Ball. Her phone number is also on slide 3 to discuss any plans. Now, prior to surgery, just some things that you're going to need to accomplish. If your surgeon wants you to get clearance from your primary care doctor as well as other physicians like cardiologists, they're going to be using the results from your pre-admission testing completing at Monmouth Medical Center. It takes us about 2 to 3 days to get the results from pre-admission testing to there. So just give us about 2 to 3 days after pre-admission testing to make those clearance appointments. Now, medications you need to stop. Your surgeon will send you a packet, and in their packet will tell you how far in advance you need to stop any medications that thin your blood. A good rule of thumb is at least 1 week prior to your surgery, you need to come off of any anti-inflammatories or NSAIDs. NSAIDs are such as Motrin, Advil, Aleve, Celebrex, Meloxicam. You cannot take at least the week before your surgery. Now people say, if I can't take my Advil or Motrin for pain, what can I take? You can take Tylenol or generic acetaminophen up until the day of your surgery, and you can take something stronger. So if you've ever been prescribed Tramadol or Percocet, a muscle relaxer like Valium or Flexeril, or something for nerve pain like gabapentin or Lyrica, those are all fine to continue to take. It's just those medications like Motrin, Advil, Aleve we do not like at least a week prior. Doctors also like you off of anything with vitamin E in it. So if you're on a multivitamin, please stop that multivitamin a week before your surgery. If you take some vitamins separately, like calcium and D and C, those are all fine. It's just the multivitamin because of the vitamin E that's in there that we don't like. And lastly, any fish oils or any herbal supplements. So if you take any herbal supplements like turmeric, please stop them at least 1 week prior to your surgery. If you take any prescribed blood thinners like Plavix or Coumadin, Xarelto, please refer to what your cardiologist or primary care doctor and surgeon agree on when to stop those medications. It's also very important, and I will remind you of this on discharge, to stay off of any NSAIDs like Motrin, ibuprofen, Advil, or Aleve after the surgery as well. Not only do they thin your blood, but they've been found to inhibit your new bone graft from fusing together. So after surgery, please don't go home and start taking Motrin and Aleve for some pain. Tylenol is fine, but that's it until your surgeon gives you the okay. Now, how long can you plan on being here after a spinal fusion? On average, patients stay between 2 and 3 days. And when I say 2 to 3 days, keep in mind that does not include the day of your surgery. The day of your surgery is considered post-op day 0. It does not count as a day. So say my surgery is a Monday. Monday is day 0, Tuesday is day 1, Wednesday is day 2, Thursday is day 3. So most patients are discharged between day 2 and day 3, depending on how you're doing with physical therapy. Please keep in mind that discharges on the weekend happen exactly the same way as they would on the weekday. You could still get any necessary equipment and prescriptions before you leave. Now, just to go over a little bit about the surgery. A lot of people ask what they're going to be doing while you're getting surgery. I draw it because I think it makes it a little easier to understand why you have so many restrictions after your surgery. So we're going to say we have L2, L3, L4. We have your vertebrae, and each vertebrae has a little disc that's in between there. What's causing your symptoms now, numbness, pain, weakness, etc., is that that disc could be herniating or pressing on the nerve, or the disc is so run down that it's bone on that nerve. So what is your surgeon going to do? While you're in surgery, he's going to remove the disc completely so that it's not putting pressure on the nerve anymore. But he's going to replace it with a cage, or some doctors call it a spacer. They're going to fill that cage or that spacer with bone graft. And that bone graft will eventually fuse, which is why we call this a lumbar fusion, with your vertebrae, creating one big one so there can't be any movement there to press on the nerve. However, it does take several months to get a solid fusion, which is why we have to put some hardware in there. So our doctors are going to put a plate, or some doctors call it a rod, and screws. So really, it's the hardware that holds it together as that fusion is ultimately fusing. Now that hardware is meant to stay in for life, so there is no second surgery to take that hardware out, but it's ultimately that fusion that we want to heal. So that's why you're going to have some restrictions after surgery to really let that fusion heal. Now, what to pack when you're coming into the hospital with us? I want you to bring 1 to 2 pairs of loose-fitting clothes with you. Part of physical therapy is occupational therapy. So things like getting dressed, going to the bathroom, it'll be helpful to have 1 to 2 pairs of loose-fitting clothes with you so we can practice. It does usually get pretty chilly in the hospital, so I suggest bringing a sweater or a robe as well. As far as shoes go, quite honestly, most people use our cute little yellow socks the entire time that they're here. But to go home with, just bring a nice loose shoe. You could bring your toiletries like toothbrush, toothpaste, deodorant to get up and washed in the morning. I want you to bring back your incentive spirometer, which is this little breathing machine that you're going to get from PreAdmission Testing at Monmouth Medical Center. If you do have sleep apnea and use a machine, please bring that with you with all your settings programmed in there for me. And the TVs are already turned on for you, but we also have free Wi-Fi on the floor, so feel free to bring cell phones with a charger or a tablet for when you have some downtime while you're here in the hospital. Now that was what I do want you to bring. What I don't want you to bring are any medications. Please do not bring any daily medications with you to the hospital. All we like is a list so that we can give you the medications while you're here. And also, please don't bring any equipment with you. So if you do have a rolling walker already, or if you have any of the equipment that we go over, I'd rather you leave it at home and use ours while you're here, just so that things don't get misplaced. As far as physical therapy goes, each day that you can get out of bed, you will have 2 rounds of physical therapy until you're cleared by the therapist. We have an orthopedic gym that's on the unit that you'll be on for the 2 to 3 days. So each day they'll bring you down to that physical therapy and work with you on physical and occupational therapy until you feel safe to go home. Now, physical therapy after spine surgery tends to be a little different than we think of it with physical therapy. It's not so much stretching and building up muscle. It's more occupational therapy. So going about my day-to-day activities safely so that when I go home I feel okay even with my restrictions. So as far as what are my restrictions? As far as your restrictions go, if you could take one thing away from your time with me, it's to remember your restrictions. Now, the length of these restrictions will vary by surgery and by surgeon. But a good rule of thumb is for at least the first 2 weeks until your follow-up visit with your surgeon, you want to abide by then. At that point, they'll let you know how much longer before you can start progressing on. So your precautions are no BLTs, we call them. No bending, no lifting, and no twisting. So what does that mean? Let's break it down. No bending means no bending past 90 degrees. So I could go to about my hip level, but I wouldn't want to just bend over and grab something off the floor. Same thing, if I'm sitting in a chair and I drop something, try to avoid bending to grab something. Also with no bending is you don't want to sit on anything that's considered too low. Now, how do I know if it's too low? Easiest way to think about it. If your knees are even with your hips, like the way I'm sitting now in a basic chair, you're fine. If your knee pulls higher than your hip, you're sitting on something that's too low. It's putting too much pressure on your lower back. So the most common places that we see that is a toilet seat. So please check your toilet seats when you're home. And if you do have a low one, we could try to put through a commode through your insurance. If they cover it, you'll get it before you leave the hospital here. So that's no bending, no lifting. No lifting is more than about a gallon of milk. So really, no lifting other than day-to-day putzing around. And then no twisting at the waist. So you want to avoid bending or twisting around you to grab something. So no bending, no lifting, and no twisting. And another big rule is we do like you to avoid any sitting in a straight back chair, like the way I'm sitting right now, for more than about 20 to 30 minutes at a time. The reason why is that gravity is putting a lot of pressure on my lower back. So you'll feel it. You'll know after about 20 to 30 minutes, you're going to either have to stand up or switch positions, and then you could sit back down. Now that 20 to 30 minute sitting rule only applies if my legs are down. If your legs are up, so you're sitting in a recliner, a couch with an ottoman, or in bed, there is no time restriction on that. It's only with your legs down. As far as sleeping goes, how can you sleep after this surgery? You could sleep on your back, or you could sleep on either side. We do suggest putting a pillow between your legs to keep your back nice and straight after the surgery. Now, I gave you a lot of restrictions, but the one restriction that you really don't have is walking. Walking is one of the best things that you could do for yourself after your surgery. There is no limitation on how much you walk after your surgery. You want to do it in moderation and listen to your body. Don't push yourself too much too quickly, but you can do walking after your surgery. So physical therapy will really focus on teaching you your no bending, no lifting, no twisting rules to get you home safely. But remember, when you leave the hospital, there will be no physical therapy outpatient for the first several weeks. Now, a back brace. Not every patient will get a back brace after a lumbar fusion. It does vary by surgeon. If your surgeon decides that he wants you to have a back brace, I'm just going to do a little demonstration on how you would use that back brace. The back braces that we use usually look like this. They're very basic. You're going to put it on your lower back, and then you're going to Velcro around like that. Turn around. After you Velcro it, you're going to take these little straps here. You want to hold that one, John? And then you're going to pull them out and then put it around. So if you do have a back brace, that's how you'll be using it. If you have a back brace, the only time you need to wear it is when you're out of bed, up walking, standing, or sitting in a straight back chair. You don't need to wear it to go to sleep. Easy way to remember it, if your feet are on the ground, have your brace on, walking, standing, or sitting in a straight back chair. Once your legs go up, so you're on a recliner, you're on a couch with an ottoman, or in bed, that brace can come off. So again, not every surgeon will order a brace, but if you do, only on when you're out of bed. Okay. Now, potential equipment needs. The only piece of equipment that insurance usually covers for you is that basic rolling walker, which will get delivered to your room before you're discharged from the hospital. And some insurances will cover a raised commode, which if they do, we'd get that delivered to you as well. Everything else that I show you is considered helpful, but not necessary. So you would have to go out and purchase it, whether that be at a surgical supply store or online. So as crazy as it sounds, one of the hardest things to do after spine surgery is get your socks on. The reason why is you're not going to want it bending, right? That's bending too much. And you don't want to be pulling your leg up too high. Your knee is much higher than your hip. So how do I get my socks on easily? They came up with something called a sock aid, where you actually put your sock on the end of it. You throw it out like a fishing line, and you pull it in. So you can easily get your socks on without having to bend. It often comes with a dressing stick, which has a hook on the end of it to help you in reverse. So again, so you don't have to get your leg up that high. You could easily get out of your socks or wiggle out of your clothes without having to break those restrictions that we talked about. So that's a socket and a dressing stick. A very helpful piece of equipment after spine surgery is a reacher grabber. They're wonderful because even if you have someone home with you most of the time, chances are you're going to have something drop on the floor. And remember, I can't just bend down and grab it right after surgery. So this allows me to pick it up without having to bend at all. So a reacher grabber is a wonderful piece of equipment. And also another helpful piece of equipment is a long-handled sponge. It's very helpful because a lot of the times when we do some bending and some twisting is in the shower. So with one of these long-handled sponge, you can easily get washed up without having to bend or twist in the shower. Also, I strongly suggest, and if there is one thing you should go out and get before surgery, is if you do not have a handlebar or something to hold on to while you're in the shower, I suggest getting a suction cup grab bar for your tile. Because although you'll feel comfortable to stand in the shower, you should always have something to hold on to when you're a little bit weaker in those first couple weeks. So again, all those pieces of equipment I showed you can be purchased, whether that be at a surgical supply store or online. Now I know I gave you a lot of restrictions, no bending, lifting, twisting, or sitting for prolonged periods of time. However, you are allowed to do stairs. Stairs are not breaking those precautions. You can go up and down stairs. However, as you can imagine, you're not going to feel up to going up and down them 5-10 times throughout the day. So set up your house before you get to the hospital to limit the amount of times that you'll need to go up and down the stairs. But stairs are fine to do after your surgery. Now some pieces of homework for you. You're going to get this incentive spirometer in pre-admission testing at Monmouth Medical Center. I'm sure you've heard about people talking about getting pneumonia after surgery. The reason why that's even a possibility is because after surgery, you're going to be lying in bed a lot more than you normally do. When you lie in bed, you forget to take big, deep breaths. If you don't take big, deep breaths, you could get some fluid buildup on your lungs, which could turn into a fever and eventually pneumonia. So to prevent that from happening, we're going to give you this breathing machine. It's very important for you to use before and after your surgery. We're going to give it to you in pre-admission testing because we like you to start it 3 days prior to your surgery. All you're going to do is take a big, deep breath in like you're sucking through a straw. Hold your breath for about 3 seconds once you do it, and then let go. You're going to start it 3 days prior to your surgery, about 10 times, 3 times a day. So 10 big, deep breaths around breakfast, lunch, and dinner. Bring this back with you to the hospital, and we're going to have you do it even more frequently, about 10 big, deep breaths every hour you're awake. It is very important to do because you don't want any fluid buildup on the lungs, which could turn into a fever and pneumonia. Here you'll see John demonstrate the incentive spirometer.
All right, so this is your incentive spirometer. And if you notice, these little devices go up and down. I don't know if you can see that clearly, but this white indicator will come up as you're breathing in. And there's also a little yellow indicator which will go up as you're breathing in as well. There's also a little arrow device that slides up and down on the side here, okay? Now, this comes with, of course, instructions. And the instruction sheet in the center has 2 charts, one for males and one for females. And what it does, it tells you what to set this arrow device on as a goal. All right, so you look up your height and your age, and it will tell you what setting to set it on. Mine comes out to 2,000, so I'm going to set this at 2,000. And when I do the exercise, I need to try to get to at least 2,000 or better, okay? Now, the trick is you want to breathe in slowly. You don't want to breathe in too rapidly because you're really not extending your lungs. Like that, that's really not extending your lungs. You want to breathe in nice and slow. All right, so you're going to suck in on this tube like you're sucking in on a straw, okay? You do not blow into this. You want to breathe in on this tube, all right? Now, this white indicator is going to come up, and it's going to come up to hopefully where my goal is, or better. And this yellow indicator will come up as well. And there's 3 settings here, and it says best. You want to keep it in the best area. The top of the yellow indicator will be at the best area, and the white indicator you want to get up to the arrow. Okay? Again, like I said, you want to breathe in slowly. When your lungs are totally full, you want to hold your breath for 3 seconds and then release it slowly. All right, let me just demonstrate. That's probably going to be the easiest thing to do. All right, so like I said, I'm going to breathe in slowly. I'm going to hold my breath for 3 seconds and then release it slowly. All right, so I got to 2,500, above my 2,000 mark, which is good. And don't be alarmed when you first start doing this if you don't quite make your goal. Continue doing it, and eventually you will get there. All right. Now, everybody will start 3 days before you come to the hospital. You're going to get one of these things when you come in for your pre-admission testing. All right, so you're going to do this at home, and you're going to do it 3 times a day, 10 times an hour, okay? And I'll explain it. I like to say after breakfast, lunch, and dinner. After breakfast, take 10 inhalations within 1 hour. Don't take 10 in a row because that could get you a little lightheaded, and that's no good. So take 2 or 3 inhalations and then pause about 5 minutes and take another 2 or 3 inhalations and pause another 5 minutes or so, as long as you do 10 within the hour. Then in the afternoon, after lunch sometime, do another 10. And then in the evening, do another 10. Okay, that's the minimum. You could do more if you like, but you need to do it at least 3 times a day. Bring this back to the hospital with you when you come back for your surgery. You're going to be using it here in the hospital as well. If you forget it or if you lose it, if you break it or anything like that, don't worry, we have plenty here. But when you come up from surgery, you're going to be doing this again 10 times an hour. The only difference is you're going to be doing it every hour that you're awake. All right. We won't wake you up in the middle of the night to do it, but you're going to be doing it all day long, and it's extremely important that you do this. Like Nicole said, if you don't, you could wind up with fluid on your lungs. And the worst case scenario would be pneumonia. And if the very least, you could get a fever. And if the fever is high enough, you're going to wind up spending a couple more days in the hospital. So it's called your incentive spirometer, or an IS. Most of us just call it a puffer.
Another piece of homework for you is we like you to get on a stool softener coming into surgery. The most common side effect of narcotics as well as general anesthesia is constipation. And with an incision on your lower back, you don't want to be straining. So we do suggest that you take a daily stool softener. Colace is a really good one to take. We'll give it to you while you're here in the hospital as well. Take it 3 days prior to your surgery, not including the day of, and that will help kind of stimulate the bowels so that after your surgery you'll have less of an issue. Please have that Colace for when you go home, because whenever you're on narcotics, you have to pair it with a stool softener. Now, it's the day before my surgery, so I've been practicing my incentive spirometer. I've been taking my daily stool softener. Now it's the day before surgery. If your surgery is a Tuesday through a Friday, you'll get your phone call the day before. If your surgery is a Monday, you'll get your call the Friday before. Keep in mind that that phone call comes after 3 p.m., so it's not until late in the day that you'll get that phone call. They're going to have you come in 2 hours prior to your scheduled OR time. The earliest surgery here is 7:30 a.m., which means the earliest time you'd have to be here is 5:30 a.m. If you have any questions on what time you need to come in, the best number to call is on slide 15. After you get your phone call on what time you need to come in, it's time to cleanse before your surgery. So you're going to get wipes in pre-admission testing. So when you come for pre-admission testing, you'll get wipes. They're called chlorhexidine wipes. They're basically antibacterial wipes, and they prevent you from developing an infection after your surgery. With the wipes will come instructions, but simply all you're going to do is the night before, shower normally. Shampoo, conditioner, body wash, whatever you normally use. Get out of the shower, dry off completely, and wait about 2 hours. After 2 hours, you're going to take out your big package of wipes and wipe down your entire body from the neck down. After that, you do not shower, which means you're not showering the morning of your surgery. All you need to do the morning of your surgery is take out your single set of wipes that you'll get from pre-admission testing and just wipe down your surgical site. So do your torso and your back right before you come into the hospital. And avoid any lotions or creams the morning of as well. So you'll get these in pre-admission testing. If your surgeon told you to go out and buy a body wash or gave you a body wash to use, please use that body wash instead of the wipes. Now everyone's going to be swabbed for MRSA while you're here for pre-admission testing. That's that Q-tip they're going to stick into your nostrils looking for a bacteria that could potentially cause a staph infection. If you do test positive for MRSA, don't panic. Many people will test positive for it. But your surgeon's office is going to call you and call in an antibiotic ointment that goes in both nostrils 5 days prior to your surgery. So if you do test positive for that swab, the instructions on how to use that ointment will be provided for you in pre-admission testing. If you test negative for that swab, nobody calls you about it. So if you don't get a call about it, you're just doing your wipes the night before and morning of. Now after midnight, it's the morning of my surgery, you're going to be nothing by mouth after midnight except your approved medications with a small sip of water, and that's it. Remember, you're not taking a full shower. You're just using your last set of wipes on your surgical site right before you come into the hospital. When you come to Monmouth Medical, come to the main entrance. You could either park in the parking garage or valet your car. And when you come into the main entrance, let them know that you're going up to the operating room. Our operating room is located on the 4th floor with the Todd elevators. Now, when you get here, you're going to be welcomed by our team. Your surgeon's going to come out and greet you before you go into the operating room. Surgery times will vary greatly depending on surgeon and by the levels of fusions that they're going to do, but we'll be communicating with your family to let them know when they can meet you up on the orthopedic unit. Please note that your family cannot come into the recovery room. They'll meet you up on the orthopedic unit when we tell them you're good to go. Now, as far as anesthesia goes, you guys will be going under general anesthesia for your surgery, which is why it is so important to, 1, use that incentive spirometer 3 days prior and after your surgery, and to take your stool softener 3 days prior and after, because the anesthesia can bind you up as well. When you wake up in recovery room, you're going to have a lot going on. You're going to be in a big room with a lot of different people in it. Remember, your family cannot meet you in recovery room. But what can you expect in recovery room? Most patients, not all, but most, will wake up with a Foley catheter in place. That's the tube that's going into your bladder to drain the urine. That's usually it just for the first night, and then we could take it out once you're getting up and out of bed. You could also expect to wake up with a pain pump. Again, this is not for everyone, but most of our fusions wake up on a pain pump. Usually that pump is hooked up to either morphine or Dilaudid, and you're going to get a little button, and your nurse is going to say, you press this button every time you need a small dose of pain medication. You cannot give yourself too much. It locks itself out, but it's patient controlled, so you could use it when you need it for the first night or two. Before they send you home, they're going to transition you to oral pain medications from your IV medication. This usually happens on post-op day 1 or 2, depending on your pain. Once we take you off the IV medications, we like to put you on 2 types of pain medication because you usually have 2 types of pain. The first type of pain is more the incisional pain. It's kind of that obvious where they made the incision surgical site pain, which we tend to send patients home on oxycodone or Percocet for. But you also tend to get a lot of muscle tightness or spasms in the area. So we like to send you home with a muscle relaxer. Something like Valium or Flexeril is common for that. Also, ice will help with pain. Ice is a great way to help with some of the pain that you're going to have, as well as some of the swelling you might have around the area. So you could absolutely put ice on your back. Just avoid any direct heat on the area that's going to cause any swelling. Please remember that while you're on the narcotics, you need to be on a stool softener. So have that Colace at home for you and start taking that twice a day when you go home to prevent getting constipated from the narcotics. And also remember that when the narcotics get too strong, the only thing that you can take over the counter is Tylenol or generic acetaminophen until your surgeon gives you the okay to go back on any anti-inflammatories. You'll also might wake up with a drain coming out of your back. So most fusions do wake up with a drain. It looks like one of these. The drains are put in during surgery to prevent any blood or fluid from accumulating around the incision, basically creating a big bruise. These drains are only while you're here in the hospital. They will be taken out before you leave the hospital. Now, the nursing unit that you're going to be on is called TOD 6 East. It's the TOD elevators, the 6th floor. Remember, we do have the gym on the unit where you'll go down to physical therapy twice a day, practicing your home skills with no bending, lifting, or twisting. Just a friendly reminder that for those first couple days until you're cleared by physical therapy, please never get up without a walker and a nurse. As far as blood clots goes, when you wake up from surgery, you're going to wake up with these cute tights on your legs. They're called compression stockings. They prevent blood from pooling in the calves and your legs getting swollen, which will prevent you from developing a blood clot after surgery. They go on during the day, they come off at night, but as long as you're ambulating when you go home, you do not need to go home with these stockings. You'll also wake up with these wrapped around your legs. They're called Flotrons, and they attach to a little machine at the bottom of the bed to pump air in them to keep everything circulating. Again, you will not go home with them either. If you did ever develop a blood clot when you go home, it usually begins in the calf, and your calf gets really big, hot, red, swollen, and very, very painful. If that ever happens, you call your doctor immediately. Now, as it gets closer to discharge, we're going to be transitioning you from your IV medications to oral medications. Now, what can you expect to go home on? Usually, we like to send you home with 2 types of pain medication because you're going to have 2 types of pain after this surgery. You're going to have the obvious incisional pain, which we usually like to send you home with on something like oxycodone or Percocet for. And then you're going to have some muscle tightness or spasms. So usually we like to send you home with a muscle relaxer. Again, this does vary by surgeon, but most patients will go home with something for incisional pain and then a muscle relaxer as well. On discharge, we'll come to your room to do your discharge instructions. We like you to do at least 1 round of physical therapy in the morning. So anytime after 11 a.m. is usually fine to be discharged. Some common questions that I get on discharge is, when can I shower? You are allowed to shower 3 days after your surgery or 24 hours after your drain was pulled out. The dressings that are on your back are going to be a nice waterproof dressing. So that dressing can stay on until you see your surgeon in the office. And if it falls off, you would just replace it with a new waterproof dressing. When you go home, ice your back. Ice feels great after your surgery. It will help with a little bit of pain and swelling that you have. Just avoid direct heat on the area. That might cause a little more swelling. Remember, when you go home, no bending, no lifting, no twisting, no sitting in a straight back chair for about 20 to 30 minutes at a time. But you can do frequent walking. Stairs are fine. You could be a passenger in a car as well. One of the best things that you could do for yourself, and quite honestly, it's the reason why we started doing these classes for spine surgery, is that people didn't feel prepared when they went home. So when you go, or when you're coming into surgery, prepare your house. Go about your day-to-day activities and think about, what if I couldn't bend, lift, or twist after my surgery? That's going to give you a great idea of maybe the food that I want and the clothes that I want to wear should be at waist level. Remember to restrict how often you have to go up and down stairs. So prepare your house so that when you do go home, you do feel safe. I hope that this video helped to prepare you a little bit for your spine surgery. Please remember, if you have any questions on the material that we went over or any surgeon-specific questions, please don't hesitate to call me or email me about absolutely anything. Thank you.